had an MRI, and there was a liver mass that was enhancing. This was an outside MRI that we read. Or we don't, I guess, just reviewed. So there was this mass, 2.7 centimeters, segment 3, and there's another little exophytic mass here too. Here it is, 2.1 centimeter, right? So we think about LIRADS 2017, and so I think this one, I don't think I have it up, but base left liver mass. Oh yeah, so it becomes LIRADS 4. So 2.7 centimeters, arterial enhancing. There's no washout. No, or I don't think there's washout. Is there a washout? No, I wouldn't call it washout. And no capsule. So it becomes LIRADS 4. So they got referred to our transplant center. And then we went ahead, left, okay, number 2. So then they got a repeat MRI, and that 2.7 lesion is gone. This is also, let's see, this was done at Loma Linda. This was before I came, and the arterial phase acquisition was like super early. But we changed that since. So anyways, we don't really see it very well, and it could just be actually a timing, or often timing, but here it is. It's more of a portal venous phase, maybe. We see the portal vein. So it's not there. And then the patient, liver mass here, got a CT abdomen, and I read the second CT abdomen. They had one CT abdomen pelvis. They said there's no liver mass, and then when I got on service and I saw this. So this is a late acquisition. So well, not really. It's still early, but because the portal vein is not that lit yet. But we don't see it. Here's the venous, and that little exophytic thing is there, but the larger 2.7 centimeters not there. So I saw, I mean, I don't know if this is, but so after that first MRI, they biopsied it, and the biopsy came back as benign, no HCC. There's cirrhosis, fibrosis. PET-CT was negative, and then the first subsequent CT abdomen pelvis done was negative, and I read the one from November. Spontaneous regression of HCC has been described, and I actually saw a case of that when I was a fellow. A patient who came in with a LIRADS 5 lesion enhancement washout on an MRI and met, LIRADS definition of LR5, hepatitis, and then he came into IR clinic where I saw the patient for ablation, and then they got a repeat MRI done, and then it was gone. Like that LR5 lesion was gone, and you looked at the old setting, and it was like clearly an LR5 lesion. Like in this case, it was LR4, but it didn't have washout, but it was an LR4 lesion. So this was something that was raised at the time, and that I'm going to raise again in this case, which is spontaneous regression of HCC. And they said there's been in this paper there were 75 patients that were described to have spontaneous regression. 30% attributed to tumor hypoxia, 30% due to systemic inflammatory response. And that paper did a literature search. And so here the patient had regression of lung mets after TACE ablation. They felt to be due to a systemic inflammatory response, regression of cholangitis, complete necrosis on biopsy. It's really sort of a secondary result of an intervention that was done for something else entirely. Here, there's a regression after an occlusive thrombus of the right portal vein. So in my dictation, I raised that this could be an explanation for why that pretty significantly sized mass, 2.7 centimeters, we no longer see on at least 3 subsequent follow-up imaging. What do you guys think? Am I just... So, I mean, I don't see it's not hypo. I don't know.
Yeah, so then maybe it was just kind of, it does look really real in the arterial phase, but, and then I think, like, actually this whole thing about the early arterial phase is an interesting point, too, because I think these can be very sensitive, and we see this a lot with, like, neuroendocrine tumors, too. It's like,
Yeah.
depending on the phase you catch that, you'll see many more tumors, and then they'll come and go, so, yeah, but it's good to know about the spontaneous regression.
Yeah, or it could be perfusion, like you said. I don't know. Okay, that's all I have.